Hey guys, welcome back to another episode of Unleashed Conversations with Vet Techs. My name is Joe, your host. I am a vet tech, and before we get into today's episode, there's a couple things I just want to talk about. As a new content creator, I've been noticing like a lot of other content creators voicing their concerns about people, I guess, basically doom scrolling and not playing their full content all the way through or playing their whole videos all the way through. And this has happened to me as well too. And it stinks, because if you don't play the video through, it like suppresses the content, it suppresses the engagement, and it suppresses how far it reaches. So I typically will watch other people's content, and even if it's something I'm not particularly interested in, I'll play it through just to support them, because I know how much effort it takes to go into making these videos, editing them, and then publishing them. Also, I wanted to thank anybody that has been supporting me and watching my videos through. Your support is greatly appreciated. I thank you a lot for that. And we are going to talk about today something I see very common in the emergency animal hospital that I work in. It's acute gastroenteritis, or when your dog is like basically got a tummy situation. There's different terms that it goes by, which we will go over later. And yeah, so that's what we're going to talk about. Before we go any further, just so you know, I am not a doctor. I am not diagnosing anything. I'm not really giving medical advice. I'm just sharing my insights, sharing my experiences as a licensed veterinary technician with 20 years of experience. So that is what we're going to be talking about today. Okay, so what is AHDS? So acute hemorrhagic diarrhea syndrome, previously known as HGE, however you want to say it, is basically characterized by a dog that has sudden vomiting, lethargy. I gotta be careful because I don't want any violations, but like bloody loose stool, something that kind of looks like strawberry jam is what we see commonly. And it's a pretty uncomfortable situation for your dog. That's why it's very important to make sure when you start seeing these symptoms or when your dog isn't acting right to bring them to the vet immediately. Because the most frustrating thing is, like, as a nurse, when somebody comes in, they're like, yeah, my dog's been vomiting since Sunday and now it's Wednesday. I'm like, why are you coming in now? This dog has been vomiting for days, hasn't been eating for days, has probably been in pain for days. And now, because of that, we're going to have to run diagnostics, and it's going to involve a more intensive treatment protocol, and that's going to cost a lot more money. So the main thing I want to stress here is that when you see these symptoms, the best thing to do is to call your vet right away or bring them into an emergency vet right away if you're close to one, and just get treatment or an assessment as soon as possible, because the longer these things go on, the more damage can happen, and it's just unfair to the patients. I'm always going to advocate for my patients. I can't stand when they're in pain or when they're uncomfortable. It just makes me feel uncomfortable, and that's also like one of the benefits of being a veterinary nurse. Even though they are in pain, in a bad state, you're a key factor in correcting all that stuff, giving them IV fluids, anti-nauseas, anti-diarrheals, all the stuff that's going to make them feel better. And then when they do feel better, it's very rewarding because you took part in that. And that's why I love doing what I do. But other serious situations that may present this way, we're not going to get into all of those today, but there's other things that can seem like it may be one of these conditions. But one is pancreatitis. Now, that is usually, it can happen in any dog. It's a lot more common in certain breeds, like schnauzers, for instance. They tend to get that a lot. And that's basically when you introduce something that's like really fatty, or even something new. Some dogs have sensitive stomachs, but most of the time it's something fatty. Like if you give them like ham or bacon or pork or something with like a lot of fat content, or even like some treats that are just, not made with the best quality, that can cause pancreatitis, and that's extremely painful, and that will also have the same symptoms of the conditions that we're talking about. More seriously, there's something called gastrointestinal foreign bodies, where if you have a dog that eats things that they're not supposed to, that's called dietary indiscretion. So if a dog's eating something that it's not usually supposed to, like it chews its toys and swallows it eats socks. Like my girlfriend's dog loves to eat socks, and we've had to come in and make him vomit them up multiple times, because that's pretty serious. That you definitely don't want to wait on, because that's an obstruction of the gut motility, and everything backs up. It causes severe dehydration. It's very painful, and a lot of the times, if you address it sooner than later, it can be scoped with an endoscopy protocol, but if not, usually it requires surgery, and that's very costly. That's the other thing. The longer you wait, the more expensive it's going to be, and I want to make sure everybody gets that, because a lot of the times, like even people I know and family members I know, they'll be like, they'll call me like, hey, my dog's been vomiting for 3 days. What can I do? And I'm like, bring them to the vet. There are like home remedy things that you can try maybe on the first day, which would be like something like boiled chicken, white rice, like just like a bland diet, stuff like that. Maybe even fasting. Again, always call your doctor, your veterinarian, and get their advice, because I am not a veterinarian, but I'm just sharing what I know. But the main thing, like I said, is I just want to make sure you guys know that when you start seeing these symptoms, get it addressed right away. It's going to work out better for you and your pet and your bank account. Okay, so how do we diagnose these syndromes? How do we diagnose what's going on in these conditions? Basically, you'll come in, the doctor will do a full physical exam from the nose to the tail. That's typical. We'll palpate the belly, make sure and see if we get a pain score, is what we call. It goes from mild to severe, and we'll run blood work. We'll run a regular thing, just almost like what you get at your doctor's office. We'll run a full CBC, which is your red and white blood cell counts, and then we'll run a chemistry, and that's going to be all your organ function and your electrolytes. And that's the biggest thing there, is when these animals have been vomiting for so long or having loose stool for so long, and they're not eating and not drinking, their electrolytes get imbalanced, and that can be pretty dangerous. So we need to make sure we address that as soon as possible. Another diagnostic test is called a packed cell volume, is where we take blood, and we take a little bit of blood and we put them in these tiny little tubes and spin them really, really fast, and it gives us our hematocrit level, and it's a packed red blood cell level. And the typical range for a normal dog would be 37% to 55%. But when these dogs come in, they're like 65%, 70, even more. And that means that they're really dehydrated, and we have to address them as soon as possible. Okay, now, how do we treat this? We had our differentials, we got our diagnostics back. So we're gonna go forward and treat this. Also, I just wanted to add, sometimes a diagnostic that I forgot to put in there is we'll do abdominal radiographs. On the younger dogs, we're looking mainly for intestinal foreign bodies, like I explained before. And older dogs, which can also get the same conditions, they can also have foreign bodies, but with the older dogs, we're also looking for anything more serious like neoplasia, which is like cancer. So how do we treat this? Basically, we put them on IV fluids. We really want to rebalance those electrolytes. We'll probably put them on some pain medication, try to keep them comfortable, and then slowly introduce them to small meals of a very bland diet. We have prescription diets that we give them. And my cat, why are you doing this, beautiful girl? Oh my God, this is my beautiful cat, Aries. She's smacking me as I'm trying to do this. I love you, but Daddy's trying to work. So back to what I was saying. We really want to get them feeling more comfortable. We want to get them back to eating. Like I said, we have a bland diet that we start slowly introducing them. And then usually within a few days, it runs its course with the proper treatment. They kind of bounce back real quickly. Sometimes, in rare cases, like I said, and I try to emphasize the importance of bringing them in early, we can do outpatient. We can give them subcutaneous fluids, which is fluids that we give them under their skin. It has all the electrolytes in it. We'll give them a couple of injections, like famotidine. For those that don't know what that is, that's just like an antacid type of injection to help calm the stomach. We'll give them something called Serenia, which is an anti-vomiting, and ondansetron, actually, which is a human drug, we do use it in vet med as well, and that helps with nausea, and it makes them much more comfortable. And like I said, we'll give them some pain medications. And then going home, we'll send them home with some bland diets. Sometimes they'll continue with the probiotic, as I mentioned before about the metronidazole. Some doctors think that like it ruins both the good and the bad bacteria in the gut. So that's doctor specific. Some doctors use it, some doctors don't. But basically, it's like an intestinal antibiotic that has some anti-inflammatory properties. It helps with the diarrhea. Some doctors will still use that. Other doctors are more going down the route now of probiotics to help reintroduce that good intestinal gut bacteria and reset the GI tract. Those are the main things. And again, some things are preventable, some things aren't. I'm not trying to make anybody feel bad here. Sometimes things happen. Dogs get into things they shouldn't, and we have these situations where they get really sick. And I'm just trying to drive home to you guys that the sooner the better. Sooner the better. Best case scenario, we can do some outpatient and send them home with medications and the bland diet. More moderate case scenario, they'll have to stay a couple days, get some IV fluids, some treatment, and then go home. But all this stuff is, I think, important information for pet owners to know. And just trying to help you guys keep your pets and your fur babies, however you want to call them, happy, healthy, and safe. And I think I'm going to leave it there for now, guys. I know these videos are short. I'm trying not to bore you because I know I have a monotone voice. I'm not trying to bore you and make you listen to a 15-minute CE type of video. But, this is my niche. This is my area. I enjoy making the videos. And that's it. I'm going to leave it there, and I will catch you guys at the next one. See you next time. Everybody's saying something different.
I'm so confused. I know. Yeah, I've lost.